Every Tuesday, burn centers across North America update their surge capacity in the Nevada Watchboard. This takes about 2 minutes, but it powers real-time situational awareness for the entire burn disaster network. This video walks you through the process. Why does updating our burn center status matter? Critical burn patients average more than a week of hospitalization, which means weekly snapshots give us reliable capacity estimates. When a mass casualty event occurs, coordinators and federal partners are looking at your data within minutes. An outdated entry is the same as no entry. Log in to Nevada Watchboard. Enter your email and password, agree to the terms of use, and click the yellow login button. Navigate to the Burn Watchboard data entry screen. From the Home or Overview screen, click Status Update near the top. From the drop-down, select Burn Center Status. You'll see your burn center name, select the hospital you're updating, and click. This opens the data entry window. In addition to your surge bed numbers, the system asks you to report your unit's current operational status. You have 3 options. Green means conventional, normal bed capacity, normal staffing and resupply, no significant resource constraints. Yellow means contingency, you're beyond typical capacity, procedures may be delayed or patient-to-provider ratios are expanded. Red means crisis. You cannot meet demand even using non-patient care areas, critical resources are unavailable, or you are actively managing a significant event. You'll need to select a status update type from the Pick menu. For your routine Tuesday update, choose Status Update. Information. This tells the network your entry reflects normal weekly reporting, not an active event. Keep in mind, this field is visible to everyone on the watchboard, so the label matters. If your situation warrants it, you can select multiple options from the menu to more accurately describe the reason for your update. Current burn unit census. Enter the total number of patients your unit is actively caring for right now. This field is required and cannot be skipped. An accurate census is the foundation for everything else you're about to enter. If your census is incomplete or estimated, note that in the comments rather than leaving the field blank. Next, enter the total number of beds in your burn unit. This number doesn't change often, but it gives emergency managers and transfer centers a real-time picture of your utilization rate before any surge event occurs. A unit running 20 of 20 beds looks very different from one running 8 of 20, even if the surge numbers are identical. Now you'll indicate how many adult and pediatric patients your center could accept right now with no notice or very little notice. Think of this as your true immediate capacity. If a house explosion happened in the next hour, how many patients could you take? Enter adult and pediatric numbers separately. The next section captures how many patients you could accept with 12 hours of advance notice, broken down by clinical category. There are 3, red, yellow, and green. You'll start with your most critical category. Red patients have burns exceeding 20% TBSA, or burns combined with trauma and airway compromise. If a red patient also has a significant head injury, they should be routed to a facility with a level 1 or 2 trauma center. Yellow patients have burns between 10 and 20% TBSA, with suspected inhalation injury or possible intubation required. They are normotensive with a GCS greater than 14. These patients are serious, but not yet at the complexity level of your red category. Enter adult and pediatric yellow beds separately. Green patients have burns under 10% TBSA, no inhalation injury, no endotracheal tube, normotensive, and a GCS greater than 14. These are your lower acuity burn admissions. Green capacity is often where centers have the most flexibility, but it still needs to be entered accurately since it shapes how coordinators distribute patients across the network. Next, input pediatric surge bed availability with a 12-hour notice, following the same definitions and guidelines as you did with adults. The system defines a pediatric patient as anyone under 14 years old. If your center uses a different age cutoff, use the sticky note feature to flag that for coordinators and transfer centers. That small addition prevents mismatches when patient movement decisions are being made under pressure. Note, surge numbers are not just empty beds. They represent the additional patients your unit can realistically absorb given your current staffing, caseload, and equipment. A bed without staff is not surge capacity. Your burn surgeons or designated nursing leaders should make that call if you have questions. Before moving on, you have the option to select additional comments from a Pick menu to help coordinators understand your current situation and operational capacity. Options include normal operations, localized surge and managing, short staff, need equipment or supplies, need decompression, burn center saturation, burn center diversion, other diagnostic limits, evacuating or relocating, adult center only, pediatric center only, no designated burn beds, beds can be adult or pediatric, and no trauma. You can select multiple options, and like the status type field, these labels are visible to everyone on the watchboard. There is also a free text field for additional notes. Use this space to provide any context that the Pick menu options don't fully capture. Keep in mind that this field clears with every update, so it's intended for information that is specific to your current situation this week. If you want coordinators to see it next Tuesday, you'll need to re-enter it. Sticky notes are a separate free text field that persists from update to update until you manually change or delete it. This is the right place for standing information about your center. Your age cutoff for pediatric patients, a long-term staffing constraint, a facility limitation that coordinators should always know about. If it's something that's true every week, it belongs in a sticky note, not the additional notes field. When you're ready to submit, click the yellow Send button. If the button is not yellow, One or more required fields were left blank or not entered correctly. Go back through your entry and check your census and bed fields first, as those are the most commonly missed. Once the button turns yellow, your entry is ready. Click it, and your update will be live across the network within 2 minutes. After submitting, navigate to the Burn Watchboard to confirm your numbers and comments are reflected correctly for your facility. If you notice a mistake, no problem. Simply restart the process and resubmit. The watchboard will immediately update with corrected numbers. No need to contact anyone or wait for an administrator to make the change. That's the full update process. 2 minutes, once a week, every Tuesday. Those 2 minutes feed a national network of burn centers, emergency managers, federal agencies, and transfer coordinators who depend on accurate, current data to make decisions during the worst moments of a patient's life. Your entry matters to your region, to your colleagues, and to patients you will never meet. Thank you for being part of the network. Nevada Watchboard. Proven. Free. Operational.